Thank you, Judge Chan and Dr. Castro Rodriguez, for your wonderful presentations. I'd like to welcome everyone to part 2 of our presentation on juvenile mental health. This is our panel discussion on youth engagement during COVID-19. The first question I'd like to pose to Judge Chan. What are some practices that a judicial officer, court staff, or a treatment provider can take to increase their comfort level in dealing with youth that may have either behavioral or mental health challenges, possibly even substance abuse or trauma?
So I was just talking about having a problem-solving court, but even if you don't have a problem-solving court in your county, there are still different techniques that you can use to work with young people who are experiencing behavioral or mental health challenges. I was talking about the pre-court meetings. Those are really helpful, but I mean, they're basically a chambers conference. And if you can create a process for the people working with the young people to tell you their stories and have information sharing in a way that feels safe, and to allow the court to listen to what's going on, that is just creating the space to have those conversations before the court hearing, so that for the judge, when you're beginning the hearing, you have some context to what might be going on. Don't make assumptions about what's happening, but again, have a process for the people working with the youth to give you the information you need to view the youth through the correct lens, and not just the interaction in court, but understanding the behaviors that are being reported. We talk a lot about trauma-informed systems. Part of having a trauma-informed system is having a mechanism for us to know the trauma narrative, to know the context in which from which a youth came and going through is experiencing life, and then rethinking or reframing what behaviors we're seeing, and thinking about how we evaluate progress. And sometimes it's baby steps, and sometimes progress and treatment is celebrating the small successes and going back to creating reasonable expectations, helping youth to define what is the next step, what is the plan, and then taking it step by step in that way.
Judge Chan, there also was, I remember you had mentioned at a previous presentation that beyond the bench, some approaches that you take just physically, spatially, and then also communicating with your court staff as to when you might anticipate or maybe suspect that you might have a contentious situation or an exchange. Do you mind maybe sharing some of those approaches that you've taken before to kind of set the table?
Sure, and communication is really the key, and through the pre-court treatment team meetings, for example, I might be given a heads up that there are some issues going on, and that someone, the parent, the youth, someone might be coming to court with having a moment that there might be some emotion to anticipate. And with that heads up, I can let my court staff know, especially my bailiff, hey, look, just be aware, but also you want to make sure that your entire courtroom doesn't become too intimidating. And I communicate with my bailiff, and they know I'll signal if I feel like I want them to intervene, but for the most part, to not react too quickly or to not overreact to situations that in a way that would escalate a situation. Because when I try to engage and when I'm having a dialogue with people that are in court, I can evaluate whether or not we're communicating or not, and I'm trying to evaluate safety for everyone in the courtroom. And a lot of times something may be loud and something may be emotional, but it's not unsafe. And so being able to have a culture in your courtroom where the courtroom team knows and is following the judge's lead on how to create this environment or space that allows us to take care of the business that we need to take care of without compromising the dignity of the court or the authority of the court. Plain English, it's being patient and being understanding and recognizing that what I'm seeing isn't necessarily disrespect to the court, and that is maybe symptomatic of the mental health issues that are presenting. So it's important to keep everyone informed so that you don't unintentionally make the situation worse by having too strong of a reaction to behaviors that might be otherwise viewed as disrespectful or problematic.
That actually leads to a really good question. Gina, I was hoping you might be able to follow up on that. Is there a way that we can identify or maybe determine whether a behavior is disrespectful or if it's just an outburst or something associated to, say, mental health or behavioral health?
I don't know if there's a way to distinguish the two, but either of those scenarios means that something else is going on. Because typically a young person is disrespectful if they feel disrespected in some way. And it doesn't have to be something that we personally have done, but it could be something that's being triggered or the circumstance feels like they're not engaged or something has happened with somebody else in their world before they come in. So I really love what Judge Chan is saying about, one, reading that and responding to it rather than being reactive to it is really important, because at the end of the day, we may never know what it's about, but the way we handle it is what's really important. And so if a young person seems angry or frustrated, I mean, does it really matter what they're angry or frustrated about? When we're angry and frustrated, we need a little bit more space, right? We need a little bit more time. And typically pushing up against that for any of us is not a great idea and doesn't help de-escalate the situation. So we can figure out later what it was about, but in the moments around it, how do we help this young person manage something that could be really detrimental to them, right? If they escalate, it could be really bad for them. So let's help them not escalate it. Let's do everything that we can. The examples that Judge Chan gave about, understanding, predicting, planning for, and then helping this young person survive it. And then afterwards, we talk about how to avoid it, right? But when you're in the middle of it, that's not the time to figure all of this out. You just want to kind of calm it down. You can have a boundary. You can have, this is the line that's not acceptable. And sometimes you might even have to say, we're not going to be able to meet today. Things are too hot. It's too escalated in here. You don't seem in the right place. I want you to be in the best place for yourself when we, discuss these next steps or what has to happen. And so we're going to pause. And it's not a punishment. It's a reality of what's going on right now. And that teaches young people how to manage those emotions. If we just control the emotion, we don't really teach them what to do with it in the future. We want to help them learn how to manage that anger, because how are they going to have a job in the future if they don't learn how to manage that? How are they going to have a relationship in the future if they don't learn how to manage that? So these are really important lessons that they can take and apply in other places.
I think those last 2 points are just so important, about one, being willing to acknowledge, like, you look upset today, you look mad when they come in, and just putting out there on the table, are you able to participate today? Are you able to listen?
Yeah.
Do you want to tell me why you're upset? It's okay if you don't. And then being flexible, and if you hit that point where the young person is just not able to participate, I will say exactly what Gina suggested. Well, I think we're not able to have this conversation today. We'll try again next time. And being flexible in what I thought I was going to do that morning. So, for example, if they're coming to court because they have a negotiated settlement, but they're upset about something, I have to be okay with not moving forward with the plan so that the young person can resolve whatever's going on in that moment. And Gina, I love what you said about teaching. I think everything we do in juvenile court is about teaching and modeling positive behavior and positive techniques, and being able to show, we're the responsible adults in the room, and how do we show and teach in our words and our responses the behavior that we want to see from the young person.
Absolutely.
Yeah, Gina, if you don't mind, do you want to maybe add, I know you both actually have already mentioned several good approaches or steps to take, but perhaps are there any thoughts you want to share as to how to best engage youth in a discussion about mental health, substance abuse, or trauma? And also, if I can just add one more layer to that question, how has COVID impacted your approach and that particular work? But to first start off, that we don't misguide us, what are some good steps to take just to begin that discussion about mental health and substance abuse and or trauma?
I think we want to listen and we want to normalize things. We want to make sure that they know that what they're going through is an experience that other people have had and that we understand. And then we want to know what's unique for them too. We don't want to, I love when people tell personal things to connect with a young person. What you don't want to do is use your personal experience to assume their experience. That's a different thing that we don't want to do. But connecting with them, very, very important. So the biggest way that you can do that is to listen to them and listen to what they're saying about their experience. They're the experts in their own experience, and they may not have all the words to put it together, or they may not, want to explain everything to you, but that you open up the space for them to tell you about it, and that it's okay if they're not okay, if they're not feeling okay, if they're angry, if they don't want to be here, that those things are understandable, yet you're going to help them get to where they can do the things that they need to do in order to get out of this process or to be successful in this process. You're gonna help them do that. And that's the empowerment part, right? We're not doing things for them or towards them, we're doing things with them. So when I worked with young people that were in custody, I would often say, look, you're in custody. You're the one living this reality right now. And what we have to do is help you get the things that you need to get out of this, right? I can't do it for you. I can do it with you. And that's what we want to teach them in these processes, is how to hand it to them so that when they go into the next situation where they need that skill, they've got it for them. It's not held by me or by somebody else, it's held by them, and they can apply it in different ways. So I think about, I love the support in person that Judge Chan talked about, those meetings in private where they can talk about what's going on for them. That helps them build a relationship, that helps them feel connected to someone. It helps them feel invested. I can't tell you how many young people have told me, like, my judge knows who I am, or they were happy for me when I did this or that. Like, those are really empowering relationships for them. So that connection is really important, making space for that and making time for it. We get caught up in our processes and we want to move along. Young people actually have a slower pace. They need a little bit more time on building that relationship and that trust.
And I think not just because, in addition to being young, I think also the nature of engagement in mental health treatment makes it difficult for the patient, the person, to understand what's happening to themselves. And so I have found that, asking questions like, how are you feeling questions don't yield a lot, because maybe it's too hard to talk about, or there isn't enough self-understanding. I found other questions that are like, what do you think other people would tell me you need to work on? What are other people saying?
It's a great way to say it.
To you is a better inroad to helping to create insight or having the conversation about what needs to happen next. Going back to creating the space, I remember another case, for example, where I knew from the probation report that it had been a pretty rough reporting period, emotional health wise. And the young person had come to court with his girlfriend, who he brought into court with him. And I knew I needed to have a conversation. And so I needed to create a space. And so I asked his girlfriend to leave. I said, you know, there's some things we need to talk about. I'm going to ask you to step outside. No disrespect, but we need to have a conversation. You know, we need to talk about a few things. And so she left, and I said to the young man, I said, you know, I asked her to leave because I have some questions that might be a little bit more private that I don't know if you want her to know about. And I just started by saying, I heard you had a rough week. And it opened up a lot for him. And he had a very emotional moment in court, and he broke down. It just tears, it just having someone acknowledge what he was going through brought up a lot for him. That led to a conversation about, well, what do we do next? And he was a young man who, over the course of years, we've been talking about treatment, and many doctors had recommended medications, and he had been resistant for very understandable reasons. But it allowed a conversation of, you know, you're going through something right now. Are there some things that might help you that you're not doing? And so the listening part is really important, and finding ways to help the young person to see themselves. So the other technique I'll use sometime is I'll just name it. You know, I'll just say, hey, you know, someone says you keep flat. You know, when you get frustrated, you get really loud. You make it. You know, you do a lot of yelling. And I said, it's not pretty. I said, you feel free to disagree with me, but you know, am I close? Am I on point? And they'll say, yeah, you're right. And then it leads to things, but I don't make assertive statements about what's going on. I say, you know, here's what I'm hearing. What do you think? You know, is it close? Is it right? If not, tell me what's going on from your point of view. Tariq, you asked about COVID, and I just want to take a moment to talk about something we're doing in San Francisco. So if it isn't obvious, I believe very strongly in system coordination. And in San Francisco, we had actually started a process in summer of 2019 related to telehealth. And it was a partnership including private medical providers as well as public, UCSF, Department of Public Health, and all the child-serving government agencies, child welfare, juvenile probation, and then also a number of community-based partners. And what we had started talking about last year was how to leverage technology to reduce disparities in mental health treatment. And there were two pilot projects. One was for family-based telehealth for young people in out-of-home placement. So thinking about reunification and reentry into the community. And for many of our young people on juvenile probation, if they're in placement, they're not in the immediate Bay Area, they're maybe in Southern California, somewhere outside the state. And so we were looking for ways to create a seamless transition in treatment, to have continuity in providers, and using telehealth to bridge the physical, the geographic distance. The second pilot project was for text messaging interventions, you know, kids on their devices. And so using text messaging to remind people of their appointments as a means of boosting engagement and participation, and also sending motivational messages by text. And hey, you know, someone's thinking about you, and you know, just something to have some more increasing connection. Mm-hmm. So we were already working on that when the pandemic began, and we already have had a schedule of monthly meetings in which, and school district is part of this too. So all the child serving agencies in San Francisco were already meeting on a regular basis to talk about integrating technology into treatment. So we were fortunate to have that structure when the pandemic began. And obviously, most mental health treatment shifted to telehealth out of necessity. So through that framework, we have continued to talk about technology and access to technology, how we can share resources across systems. So for example, one small example that I think is going to be very meaningful for youth and their families, the school district has been providing Chromebooks and hotspots to young people so they can go to school. And we said, can the students use those Chromebooks to come to court, or by video, to remotely participate in court or remotely participate in treatment? And so we're working with the school district to share the technology and the connectivity so that young people have greater access to what they need to do. And so these regular collaborative meetings that include everyone at the table have been really effective to find creative ways to deliver services in the middle of a global pandemic.
Gina, did you want to add anything as to telehealth as well? Because I know that likely has really impacted your work as well.
I want to add something about substance abuse too, and then talk about telehealth. One of the things that we have to do when we work with young people is be incredibly honest too. When you're talking to a young person and you're asking about their substance use and why they're using substances, it's really important to say that we get that it does help them, right? If a young person is using pot to sleep, or if they're using alcohol to forget bad things that are going on, or if drugs help them escape, that we acknowledge that there is some efficacy to what they're doing, but what they're doing is trying to treat the symptom, and that there's other ways that we can get to treating the symptom that will help them feel better, and that we're not just blanket trying to tell people not to use substances and not understand why they're doing it. And that will help them understand their use, and also their the ability to stop the use and to replace it with something else that is in their best interest and that is healthier and that works for them better. And then on the telehealth end, there's good and there's bad. The good is that we have young people that can engage more in services, and that it removes some of the barriers of transportation, or, even just young people that have trouble being closely connected until they know someone and being in the same space. And they can be in their own home, and they can be somewhere where they're more familiar and they're more comfortable. And so in those ways, we see people being more consistent with treatment and people engaging in treatment more and having access to it more. The relationship you have to work a little bit harder on, because it's easy to disconnect in technology. So you might have young people that don't want to have their camera on and want to listen, but then they're distracted, or they don't know what to say and it's hard for them to sit and talk. So you just got to work through those barriers with them. I think that it will be part of our future for treatment moving forward. And so we just have to learn how to overcome the barriers and how to maximize the things that really help us engage with young people better around mental health. I train the San Francisco Police Department's crisis intervention team on working with adolescents and young people. And one of the things that I really want them to understand is that young people's pace and their capacity to take in information and process it is different because they're developing that, right? And so it's not much, but there's a second or two that longer that they need for things. So the biggest thing you can do when you're doing de-escalation with a young person is give them some space and give them a little bit of time. That they're working from their emotional center of their brain, which is feeling something and reacting. And they haven't yet worked in all the process steps of feeling something, weighing their options, thinking about the consequences, looking at alternatives, and then quickly implementing that. And they're getting there. And in some cases, they can do it better than others. But when they're activated, when we're, disrespecting or confronting or pushing them somewhere, then they have less access to that part of their brain. So we want to calm things down, and we want to give a little bit more space and time. And activating that front part of the thinking brain with questions and choices and options is really going to help bring the brain together and give them some time to really act in their best interest. Because young people don't want more problems. They actually want you to mostly leave them alone, right? So they don't want to engage in something that's going to be really hard, but they will if they have to. And if we push them, then they feel like they have to. So we want to just step back a little bit and give them a little bit more space. And it's okay for them to be mad. It's okay for them to not know why they're mad. Those things are okay. It's part of the process of learning how to manage that for yourself, is feeling it and then figuring out what to do with it. So they're not all the way there yet. They're getting there though.
And I think tips for judicial officers, obviously stay calm, be aware of what's happening in the courtroom. We're responsible for the safety of everyone in the courtroom. And Gina, I really liked what you said about giving choices and how giving choices triggers that other part of the brain that might calm them down. And so give choices like, looks like you're not ready for court right now. Would you like to come back later? Should we take a break? Would you like to stay for 5 minutes and then come back? Or, so finding little ways to give choices that might help to de-escalate and maybe settle somebody down.
I remember you had mentioned using nonverbal cues sometimes, if I remember correctly, as a way to either avoid or to address when you feel a situation might get escalated. If I remember correctly, I think you may sometimes even use like nonverbal cues, perhaps.
I use nonverbal and verbal cues, and going to one of Gina's earlier points, explaining, saying, look, here's what we need to do right now, and then after we're done with that, you can leave.
Yes, great.
And being really clear. Nonverbal cues. I mean, the number one nonverbal cue from the bench is, I have other nonverbal cues to youth. When they're like slouching down in the chair and they're looking all sullen. Sit up.
Yeah.
But going back to how you use body language and being very thoughtful and intentional about how you respond, not just in your words, but also in your body language. So, if somebody's having a hard time in court, am I going to respond with my body language and my words by getting angrier? No, I'm going to take it down a notch.
Yeah.
I'm going to use a steady voice. I think sometimes I go softer, actually, in my tone, and I'm trying to control my body so I'm not reacting. I'm certainly not pointing at people and getting engaged in a back and forth, but reminding people why they're in court and what needs to happen. Here's what we're trying to do today. Are you able to focus on that? Are you able to participate in that? Okay, if you're not, we'll have to try it again another time.
Right. And for the adults, something that I talk to my staff about is we use the prompt Q-tip. Quit taking it personally, because it's not 90% of what's going on for them has nothing to do with you. Unless you directly had a conflict with them, it's old stuff that happened outside the door, or stuff that's going on with, their peers or their partners, or it's really not about you. So if you don't internalize it as about you, it doesn't activate you to be defensive back to them, and they can calm it down. So, making sure that you're centered too, that young people just have a lot of emotions. And 90% of them have nothing to do with you. So just move. You don't have to internalize it, and you don't have to react to it.
And what often comes up, especially for court, is how do you make time to do all this, right? When you have a lot of cases that morning. And so sometimes one of the choices that I will give the youth or parent is to say, it sounds like, you have a lot to tell me. It's all very important. Let me take care of the cases. Let me hear from some of these other families first, and I'll come back to you later on, and then I'll have more time to listen to what you have to say. And that has the effect of both giving them time to calm down, but they also may decide that they're not really that interested in sticking around all morning, and that they're ready to let go of whatever it is. But, validating, like, what you have to say is important. I really want to hear it. but let me take care of some other business first, and then I'll come back and we'll have more time to talk about what you want to tell me.
That's great.
I wanted to get both of your takes. Since we were talking about COVID responses, there were some questions that judges had brought up and other court staff related. I think of COVID only because COVID has had such a disproportionate impact on certain communities, particularly minority communities. I was hoping maybe you might have some approaches or considerations that should be taken when we're thinking about coordinating treatment for Black, Brown, and Asian communities. Maybe if there's some stigmas that we should be aware of, both social and cultural. I would love to hear both of your perspectives on that if possible.
For me, the most important thing is for people to listen without judgment. That our experiences may not match the experiences of people that we are working with, but it's really important for us to hear and ask questions and work within their reality and their experience, not ours. And that, just because something is easier for us or we don't have barriers to it doesn't mean other people don't, and we won't know that if we don't ask. And so we can't assume things. We can't assume that parents don't want their kids to get better, or parents are getting in the way of their kids getting better. There might be a ton of things that we don't know about, and when we open up space for it, we find out what those are, and then we can problem solve them, right? But we have to come at it without judgment, and we have to come at it without us being here and them being here. They are the experts in their experience, and we're just trying to work with them from where they are. And if we help people understand that, then we can really get through a lot of stuff that might be in the way. Stigma is very real, and acknowledging it is very real. To say, what's your experience with mental health, and what are your concerns or worries, or what are the things that make you not want to do it, and then talk about those things, because those things are very real. And a lot of times kids have only had experience with mental health when things have been very extreme and in crisis, and those are not good experiences when people get to that point, right? So, giving them information about what therapy could be. Years ago, when I worked with young people at now it's the Young Women's Freedom Center, but it used to be the Center for Young Women's Development, I used to do a whole session in the beginning about just what therapy is about and how you could talk about anything that you wanted to. And it's so unique because, one, I'm not your friend, so I'm not giving you my experiences too. I'm listening to you. And two, it's completely confidential, and it's never gonna, I'm never gonna use it against you, or it's never gonna, no one else is gonna know what you say. And just opening up the difference between a space for therapy and what their normal exchanges are in communication that may have been good and bad, that is really helpful when you're helping someone understand what therapy can be for them, right? And what kinds of things they can work on and talk about. And that the biggest part of it is building a relationship with someone that you trust, that you can work things out and talk things out with. That's really the value of mental health treatment to me.
And I think really embedded in that is from understanding and accepting that there are stigmas or cultural differences that are at play when it comes to mental health treatment for a young person, is exactly as Gina was saying, that the approach has to include the family. It has to include the parents, because the parents will ultimately need to support the youth in going through the treatment. And so it can't just be a singular focus on the youth and saying, you've got to go to therapy, you've got to go to counseling. It's also working with the entire family unit to make that okay, and to recognize, as Gina said, I think everyone really has the same goal. They want the youth to get better. They want people to thrive. And so we might just be talking about it in different ways, but getting to that understanding of how a family is reacting to treatment, and then creating the buy-in into the treatment that makes sense to the youth. And I think really critical to that is maybe in some way getting out of this mental health lens and way of talking about it, and using, language is really important. and maybe just kind of demystifying what it is we're all talking about. Are we talking about therapy for the sake of therapy? Not really. We're talking about specific behaviors, talking about issues going on. And I think when you can talk about it in terms of those specific issues, that's what people relate to. Yes, I'm going through that. Yes, I agree. I think I need help with that. Well, how are we going to go about doing that? What do you think is the best way of helping you get better? Or what do you think is the best way to help you move forward? And, sometimes I talk about treatment, again, kind of trying to pull the stigma out. It's like, hey, look, I'm not talking, I don't know what comes to your mind when we talk about mental health, but I'm talking about strengths and weaknesses. I'm talking about what works for you. What is the best way? What connects for you? What is the best way in which you learn? What is the best way in which you can move forward? That's what, and trying to talk about it in that context where it's less up here and more directly about real life problems and issues. And Gina, you also said earlier the part about like finding your people. I think one of the challenges that we all face is that sometimes or many times the clinicians don't come from the communities in which the families reside. And I think that's a systemic issue that is complicated. But Gina, what are your thoughts in terms of how to make those connections so that the youth feels like I found my people and I can relate and engage with the person trying to help me?
I think there's two steps. I'm a big advocate of expanding the capacity of mental health to include more people at different levels that come from the same communities and the same experiences that young people do, and helping bring more people into a spectrum of wellness for young people, whether it's peer advocacy or counseling or therapy, that we need more representation for young people. And then on the other side, we don't have to match people in order for people to feel connection and feel heard, but we then have to really work hard to get out of our frame and see the reality of somebody else, and to do that without judgment, to say, tell me about your life, tell me about your experience, tell me about things that are hard, tell me about things that are good, and to hear it and to integrate that into the plan to work with this young person, so that you're not doing it from some lens of this is what health is, but what is this person's reality and what do they want that looks safer and more healthy for them, and how do we get there in their own context, not in our context. And that's not easy to do, because our mental health system is framed on health and pathology and well and not well, and we have to expand what that means, and we really need to look at the person and what their circumstances and what is going on in their lives, and how could we help them get to what's going to help them be in a better space. But I think both of those things are very, very important.
Gina, what are some considerations to be mindful of when serving and coordinating treatment for young females in particular that have experienced sexual trauma and abuse?
I would say that the relationship that you have with young people when you're providing mental health services is really important, and you have to sort of compensate for things that might not have happened for them. So they've had their power taken away. They've had their ability to trust other people taken away. They've been hurt by other people. They've been let down. And so you've got to come back to help build capacity for them to trust by being consistent and dependable, and by being honest with them, and by having good boundaries and modeling the things that are counter to the experience that they've had, and just being a good, healthy adult that they can talk to, that they can share things that they can't share with other people, that they can work through things that they can't work through with other people. And you have to survive some of the behaviors that they're going to engage in that are meant to push you away, because they feel like nobody cares about them, or they shouldn't be in treatment because they don't deserve it, or they're just not going to get better. And so you know, if they miss an appointment or if they're late or if they don't want to talk, those are all protective behaviors and they're all okay and they're all part of the treatment. And we have to be using those things when we're working with them to say, I understand why you don't trust people. I get it. You don't, it's very protective of you to not trust me. And I'm just going to keep working at you being able to someday trust someone. Maybe it's not me, but not everyone out there will hurt you. And we're going to work on how to find those people and then how to connect with them, because that will be really good for you in the future. And just taking your own ego out of it. Doesn't have to be me. It's okay if it's not me. We're not here to save young people. We're here to support them. And so what can I help you get to so that you can find that in other people, whether that's a relationship or, you know, friendship or someone that you're going to seek services from? Can you find healthy people that can help you? And that's a big part of what I do when I work with young women. I think it's really important.
And Gina, you mentioned also about normalizing things. And I think especially that really applies to working with LGBTQ youth as well. And one of the most, because nobody wants to be defined by any one particular thing. And so one of the most important tips that I learned was when you're working with young people is to normalize the whole idea about LGBTQ. And in your intake interview, you ask that question just like you ask, where do you go to school? You know, who do you live with? And are you into guys, girls, both, something different? And when I put that into practice, I remember when I was a lawyer, I had a case where I represented a young man who had a history of psychiatric hospitalizations and self-medicating on alcohol and pills, and the case was a DUI. And when I did my intake interview, you know, I asked it as a normalized question, you know, and just like I described, he didn't come out to me at that interview, but something happened afterwards, which is because it was such a, he told me this, that when I asked it the way I did, he realized he needed to come out to his mom. And then he came out to his mom, and then he also came out to his probation officer. But by making it okay to talk about, he was finally able to open up about what was going on with him, which provided, you know, it unlocked the door as to what's been going on with you for the last year, you know, why, and changing the understanding about, you know, is this a mental health case because of all the 5150s to, hey, you're just a young man trying to figure out who you are, and you were going through it alone, and you're not alone.
Yeah.
And it changed, and his whole life changed. You know, things weren't fixed obviously overnight, but by normalizing it and making it okay to talk about and pulling the stigma out of it, it then became a conversation about what was important to him and not just, oh, this is about mental health care.
Thanks, Judge Chan. I think that I'm really glad that you brought up that question, because it actually anticipated the follow-up question. And that was, in particular, are there considerations, as well as Judge Chan noted, when we're dealing with LGBTQ youth and transitional age youth?
I think one thing is we don't want to assume what their experience has been. We want to ask, because everyone's experience is different. We also don't want to impose what we think a young person should do with their exploration or their understanding of their identity, that is their personal identity and they get to do what they want with it, whether that's they want to be out or they don't want people to know or they want to share it with people. It's who they are. And they get to protect who they are in the way that they want to. And sometimes I'm working with young people trying to help them decide who is valuable to get that information from you? Who can you trust to give information about who you are? Not just your gender or sexual identity, but lots of things about your history, your experience, your fears. That those things are things you get to protect. And so I see this as another way of us getting to know a young person and being grateful when they share things that they're working on or learning about themselves or understanding, and just thanking them for letting you be part of that process and offering whatever support we can. Whether that's helping them in that understanding or in that expression out in the world, or negotiating people that don't understand or that are ignorant or biased, and all of those things could be in play, but we don't know what they are until we ask, right?
What comes to mind to me as from our conversation is that at the end of the day, this really comes down to being a caring adult who listens and is patient and takes the time to understand the unique needs of the young people and their families that come before us. I think what's different for all of us, for Gina and myself, and for those of you who are who have watched this webinar, is that we also are given positions where we can do something about it, where we can bring services into play, where we can use the responsibility and leadership and authority that we're given to help young people and their families move forward and buy into and identify their needs that maybe they didn't even fully understand before they came to juvenile court. And I guess maybe the way I would sum it up is that we have responsibility to use the roles that we're given to empower our young people to have their needs met. And it's that we come from a position of humility. We're not here to define their needs and force our ideas or notions on young people, but as responsible adults who can see and have a sense of what's going on, our goal is to help young people to own it, to own their plans and own and direct their treatment and what they want to do in their lives, and so that when they're done with their interaction with us in the juvenile court process, they are more independent and they are more empowered and have connections to the support that they need in the community.
Thank you, Judge Hand, for giving us that eloquent statement to close this wonderful session. I have the greatest admiration and respect for you both, so I truly and sincerely mean that. So thank you so much for taking all the time in terms of both coordination and making it possible for us to just hear both of your perspectives. We're really fortunate in San Francisco and at large in California to have you both serve so kindly as you do. Thank you so much. Thank you for watching this presentation. Please feel free to reach out with any questions, thoughts, or ideas. If you'd like more information on San Francisco's Victim Services Division, you can follow the Facebook, Twitter, or Instagram links below. Please feel free to reach out to me personally at tariq.nizami@jud.ca.gov. Thanks again for watching this presentation.